Hi, my name is Jobin Joseph, lecturer of Department Food Nutrition and Dietetics at Milagros College. Now, I will take a small section about burns, what is burns, the causes of burns, and also the classifications of burns. Burn. A burn occurs when heat, chemical, sunlight, electricity, or radiation damages the skin tissue. Most burns happen accidentally. There are different degrees of burns. Burns can be painful. Left untreated, a burn can lead to infections. So what we do is after a burn, we have to clean the burn area and sterilize it, hence there won't be any infections. Next, causes of burns. Many things can cause a burn. Thermal sources including fire, hot liquids, steams, and contact with hot surfaces are the common causes of burns. Other causes of burns include chemical such as cement, acids, drain cleaners, or radiational damage. Also, the burns by electricity. Even the sunlight, like ultraviolet light, can cause burns. Next, signs of burns. The burn symptoms vary depending on the severity or degree of burns. Symptoms are most worse during the first few hours or days after the burn. Burn symptoms include blister, pain, swelling, white or charred skin, peeling skin, even redness of the skins has been seen in first degree burns. Classification of burns. Burns are mainly classified into four categories: first degree burn, second degree burn, third degree burn, and fourth degree burns. We'll talk about this classification in details. First degree burn. They're also called as superficial burn because they affect the outermost layer of the skin. In the first degree burn, only the top layer of the skin will turn red and it will be painful, but not typically blister because it's just a superficial burn. Signs of first degree burns include redness and pain, minor inflammations or swellings, dry peeling skin occurs after as the burn heals. Talking about the second degree burn, in the second degree burn, it affects the top layer and the lower layer of the skin. The person may experience redness, pain, swelling, and blistering. This type of burn causes blisters and become extremely red and sore. Due to the delicate nature of these wounds, keeping the area clean and bandaging it properly is required so that it prevents infections. As seen in the figure, you can see that the epidermis layer and the dermis layer is affected over there. Next, third degree burns. A third degree burns affected all the three layers of the skin, which is the epidermis, dermis, and the subcutaneous fat. Burn also destroys the hair follicles and the sweat glands. Because the third degree burns damages the nerve endings, you probably won't feel pain in the area of burn itself, rather adjacent to it. As we know that, as I told that, all the nerve endings are damaged. Hence, the area of burn, there won't be any sensations. The adjacent areas, they will have pain. The burnt skin may be black, white, or red with leathery appearance, as seen in the image. Next, fourth degree burn. Fourth degree burn goes through both layers of skin and underlying tissues as well as deeper tissues, possibly involving muscle and bone. There is no feeling in the area since nerve endings are completely destroyed here. This degree burn will need utmost care and intense care. Hence, there will be burn ICUs, special wards in hospitals for taking utmost care for these conditions. Next, burn complications. Firstly, injury infections. As we all know, the skin is a barrier to external and internal environments. Here, due to burns, there will be breakage of this barrier. So what we have to do is we have to do utmost care. Okay, we have to sterilize the area. We also have to cover the area to prevent infections. Next, fluid loss, including low blood volume. Due to a deep burn, there will be loss of blood also. That will result in fluid loss. Thirdly, breathing problems from inhalation of hot air or smoke. This condition mainly happens in a fire-caused burns. There is utmost chance that a person will inhale the hot air. that will result hot air or smoke, which results in damaging the lungs and finally resulting in breathing problems. Scarred or rigid area caused by overgrowth of scar tissue and bone joint problems such as the scar tissue causes the shortening and tightening skin, muscles and tendons. The second and third points I have told, it will happen after the wound is healed. Once the wound is healed, there will be overgrowth of scar tissues. There will be problems by joint, problems in moving your hand, or the complete motions may even be prevented in moving your elbow in knees. Thank you.